Hello, my name is Sean Mark. I'm faculty here at INMED, and today I'm going to be talking to you about who we are as an organization, what we're passionate about, and how we can help you start your career in international medicine. So the first question I want to ask you is, who are the forgotten people of our world? INMED is passionate about serving the forgotten people throughout the world, and so I want you to consider who are the people around you, whether it be the people that are disabled. Throughout the world, we have people that are refugees, like we saw in Syria. We have people that are affected by national disasters, hurricanes, floods, as we saw in Puerto Rico with Hurricane Maria. We also have global infectious disease epidemics, like we are in now. We saw the Ebola epidemic in the Congo, and now we have the COVID-19 pandemic that has affected every area of our lives. When we look at the world on a map, we see where the areas are that have the greatest degree of poverty. And a lot of the huge health disparities of our world are concentrated in these areas. But there are forgotten people here in the United States. We can see in this map that throughout the United States, there are many areas of our country that are also affected by extreme poverty and suffer similar health disparities. Like you, I want to help those people. I want to reach out and serve the forgotten, just like we can see in the story of the Good Samaritan, who found the person that was hurting on the side of the road, bandage his wounds, and help him get back to health. I remember the first time I attended an INMED conference, and I was like some of these people in this picture. I wanted to help people. I wanted to use my skills in my medical profession to help people, but I had questions. I wasn't sure exactly how to start. Some of the questions you may have are, where should you go? What organization should you partner with? Where is the funding going to come from? How is your family going to fit in? Isn't all this work dangerous? Many people might ask. So when we consider these questions, we need to find resources that are going to help prepare us to serve in an effective manner. That's where INMED comes in. We are the Institute for International Medicine, and we have a passion to equip healthcare professionals to serve the forgotten. We have professional certificate courses in international medicine and public health, international nursing and public health, and international public health alone. Some of the course topics that we cover are diseases of poverty, international HIV medicine, maternal newborn health, disaster mitigation and management, healthcare education, and health leadership. After you complete the online hybrid course that we give, you will then be enrolled in a in-classroom section where you spend several days being mentored by people who are also in the field and gain practical skills such as splinting, newborn resuscitation, complicated OB care, and suturing, as well as many other skills. After that you complete our online course and in-classroom section, you have the opportunity to serve in a different country, somewhere across the world. We have many different locations where we have one-on-one faculty mentorship, and these are just some of the countries where we have mentors that can serve you. The difference between INMED and many other organizations is that we don't do group trips. We do one-on-one mentorship with a faculty that's already in that nation that can help mentor you and prepare you for long-term service in medical missions. Whether it's in Africa, India, or in many countries in Asia, we have these faculty mentors that can help prepare you to serve. So after you complete the online hybrid course and the service learning portion in a different country, you can earn the esteemed credentials of the Diploma in International Medicine and Public Health, International Nursing and Public Health, or International Public Health. I want to talk a little bit about my story. I started off as a young professional in medical school. This is a picture with me, two of my children. I had 4 children during medical school, so I was very busy. So I needed something that was going to train me in international medicine and public health, but would also fit with my schedule. So I attended my first Exploring Medical Missions conference. That's what it was called back then with INMED. Now we're the Humanitarian Health Conference. And I learned many things in that conference, and it inspired me to serve and connected me with INMED so I could get trained. This is a picture of all the participants in my online course and when we participated in our in-classroom section. I then had the opportunity to serve at one of INMED's locations in Roatan, Honduras. The pictures along the top are pictures with some of my faculty mentors at Clinica Esperanza in Roatan. And then this last year, I've had the opportunity to do more education with INMED in China and several of the cities in the Northeast with multiple Chinese physicians from all across the country. One of the things that I love about INMED is that it brings out the best in people. We all went into healthcare because we want to help people. We have that passion to serve, and that's why I know that you're listening in on this conference. And serving the forgotten people of the world is a great way to get us back to the roots of why we went into this profession. It gets us back to why we want to serve people and teaches us humility, gratitude, and kindness. It's a cure for vanity, pride, and selfishness that we so often adopt as we go throughout this culture and even in the medical community. So we are the Institute for International Medicine. We are here to serve you, so please come and help equip yourself to serve the forgotten people of the world.